Welcome to the Grow Your Business and Grow Your Wealth podcast with Gary Helt. Gary is an expert in helping business owners put together a plan that will provide a better future for their businesses, themselves, and their families. On the podcast, Gary interviews other professionals who share his vision, and together they share secrets and strategies any business owner can use to build a better financial foundation for your business and your life.
Hey, welcome back to the podcast. This week, my guest is Matt Ohrt, and he is the co-founder of Self-Fund Health. Welcome, Matt.
Thanks, Gary. It's great to be here.
So, Matt, give us your backstory before you co-founded Self-Fund Health.
Yeah, my story, I think, is unique, and I find myself in the healthcare marketplace. But really, I came from the employer realm where I spent almost 25 years working for employers in various places in various states. So I've got new eyes, new ideas for that. But I've always had so it's interesting. I found myself in that career because I've always had an entrepreneurial spirit. Even growing up, I was the kid that had my baseball card, my own baseball card shop, if you will. And then I'd grab my shovel and I'd go door to door and come home with a wad of cash, and I'd go waste or spend it all on baseball cards. That kind of thing. And I had a construction business that I put myself through school that I grew for 7 years. And so it's interesting. I found myself there, but now I find myself there again.
Gotcha. But besides the businesses and things like that, you're also an author. You wrote a book, and it's in your background there, Save Your Company.
Right.
Tell us, what was the inspiration behind that?
Yeah, I think I was working as the VP of HR for Merrill Steel. This was in 2016. I had just taken that role. And so I had been around healthcare, if you will, health plans. I had done the enrollment meetings that you do every year. You go in and give the bad news and move on. And it's really not a big part of the business. And I think that's the way it is for most employers today. Probably should be, by the way. It's probably your second or third largest business expense. But as I went to learn, I started to have some insight into the industry and how things worked. And the owners had approached me and they said, we've been taking on costs the last 5 years. Wisconsin happens to be one of the worst 5 states for healthcare cost. And we've been absorbing that. We don't want to pass that on to our employees and their families, but we can't keep doing that. Is there anything we can do to change this trend, to change this cost increase trend for our health plan? And so that's when I really began to look and study. And interestingly, there's almost nothing out there. There's a wealth of information about the game that the insurance industry has handed the sellers, really the reimbursers in the middle, right? But one of the group of sellers, if you will, has handed the buyers, the employers and employees. There's a wealth of information on that about deductibles and networks and this game that's unwinnable for employers. But there was almost nothing about just how can an employer find sustainability with healthcare. And so that was part of the motivation behind it, is I need to get something out there to help.
Now, going through all of this, what are some of the critical factors that owners, companies should take into consideration if they're looking at doing any type of self-funding?
Mm-hmm. Yeah, I think self-funding is the vehicle, right? Self-funding is often misunderstood a lot. So it's the way you fund your plan. You're taking on a little more of the risk, but you're also getting the reward if you save money or spend wisely. And so that's the first thing to know when it comes to self-funding, is just realize that we were self-funded at Merrill Steel in 2016, but yet they were still losing year to year. So we realized that we lacked a medical strategy. But I would say is just a first point for CEOs, CFOs, HR is get it on the radar, right? Healthcare is an expense. You're buying services. It's not some unique benefit that's often Neverland. It should be on your docket of your executive meetings in terms of cost and trends, just like every other area of the business. So that the business leaders have these skills. They know how to buy steel, and they know how to buy supplies, and they know how to manage all their costs. But it's interesting that healthcare is off the radar. And really I'll tell you a quick story that, interestingly, how I learned that is as the VP of HR there at Merrill Steel, I had taken on the custodial staff, and frankly, because no one really would, and I cared about them and I felt bad, and I said, I'll do it. So they can be part of my team and they can report to me. And I will support them. So they were doing a great job. We had hired a group from instead of subbing it out and so forth. But one day we had this kind of industrial vacuum, this wide vacuum, far too wide that you'd have in your house, but it was the push version and it broke. And we had repaired it like 3 times and it just wasn't fixable anymore. So we were going through this process and we had this purchasing process as most companies have, right? 3 quotes and write it all up and so forth and so on. I found myself that afternoon, I was spending like a couple hours on this thing and it was frustrating because it was like, we know this is the vacuum. In fact, it's the same one that broke that lasted over 10 years. This is an easy decision. And here I am, right, trying to help. But I had this thought as I was filling out this paperwork. I had just signed our stop loss. This was really before we started improving our healthcare, but I had just signed our stop loss insurance agreement. That's the insurance that sits on the top of a self-funded health plan to protect on the big stuff, if you will. And all I needed, I didn't have any purchasing process. So this was part of our healthcare expenses. And I signed it for 700 grand. And all I needed was a nod from the CFO. There was no signature. There was no even formal review. And I thought, wow, so I need approval that's taking me hours for $500 vacuum. And so I think that story really exemplifies how much it's off the radar. That's pretty much every company that I've seen. That's not an exception.
So I guess in going through it, because again, you're saying, hey, this is one of our biggest costs, so forth and so on. I guess if you do the self-funding, what does it do? How does it help you as a business?
So it didn't used to be this way, by the way, 20 or 30 years ago, but the market has changed significantly and it's now a lose for the buyer, which is the employer, and a win for the seller. But it used to be that you could be fully insured. That's where you just pay the premium, right, every month. And the insurance company takes on 100% of the risk. They'll never lose, by the way. They have actuaries. They're always just going to float the boat and add it on top. So they're not too worried about that. They're always going to win. But it used to be that you could go in and get a very fair renewal and move on. And just like most employers still do it today, I don't spend any time in the healthcare, just be done with it and move back to the business, if you will. So that's no longer the case. We're seeing increases 5, 10, 15, 20, 30, 40. I've seen as high as 100% increases on the health plan cost in 1 year. Employers call me in a panic or something. It's my opinion. I think many share this opinion that it's no longer sustainable to be fully insured long-term. So then we start to talk about different options on the self-funding side. It's called level funding. It's a blend, but it's still technically self-funding. And then traditional self-funding where you either have stop loss or if you're a giant company, you just take on 100% of the risk. That's less common. But what that does is it allows you that if you end up spending wisely, if you will, if you shop for value, and let's say you keep it flat or you spend 500 grand less than you spent last year, that's the company's money. They can lower deductibles, they can lower premiums, they can buy new trucks. It's their money as the sponsor of the self-funded health plan to do as they wish.
Now, because a lot of our listeners are small business owners, is there a number of employees that you need to have that this makes sense? Is it volume that you're spending on insurance that it makes sense? What's that threshold to get it to where it makes sense for you to get into this arena?
There are some that would tell you that you can self-fund with as small as 5, and that is right. Now, the quick short answer would be more around 50. Now, that's a loose number. We have one, for instance, that's 35, I think, and so forth. The thing with what's called the law of volumes in the insurance industry, just taking on risk that if you were to get, say, a big cancer claim or a big expense and you have a small number of members, that it's harder to absorb those hits. There's less cushion to balance all that out. So it goes back to managing the medical. Maybe you can shop for that and find it at a provider that's very affordable and fair, and it doesn't break your plan, but that would just be more risk on the smaller side.
To put this all in layman's terms, is that when you're saying that there's a stopgap and stuff like that, basically what you're saying is that, hey, I'm willing to pay claims from whatever, 0 to whatever your number is. And everything above that, you have the insurance to cover that.
Yeah, so when I like it, what we call a traditional self-funding, which is stop loss on the top, there's 2 parts where the insurance could kick in. One is they call it an individual specific deductible. Let's say it's just depends on the size and so forth, but let's say it's 100,000. So if one individual on the plan would hit 100,000, the insurance, the stop loss would kick in for that year, everything after that. Then there's also an aggregate built on top of that, where if the whole plan, if the total expense would hit a number that's set, then the insurance would kick in. What's interesting, you think the aggregate would be more common, but it's something like less than 3% of the time it's even reached. So it's, of course, the goal, like anything, is you don't want to use the insurance, just like workers' comp or car insurance, right? I
Right.
don't really want to use it. They're going to make my claims go up. So I'm going to try and avoid it. And that's one of the gaps for employers today is there's zero activity to avoid it. It's just, here's a credit card, go for it, and then scratch your head and wonder why all your costs are going up every year.
Now, so looking at this and trying to navigate through it, it seems pretty complex. And obviously, I don't want us to sit here and oversimplify it, but
Right.
I'm assuming that's why you guys started your business, is to help people through this process. So can you talk a little bit about that?
Yeah, you got that. So I was in HR, say the first 2/3 of my career. And I would say this is fair for most companies and most HR professionals that manage the healthcare benefit. It's the sellers have made this so complex that you look at your broker and you say, tell me what to do. I'm busy. I got people to hire, right? And that's not so great. When you delegate, so the three sides of the sellers that are all winning in this game, by the way, that so you'd say the hospitals, the big carriers, and the traditional brokers, as I call them. There are some that are becoming more advisors and actually working for their clients, but many are tied to commissions and overrides and all sorts of conflicts of interest. So you have this group that really doesn't want things to change. Their heels are dug in for the status quo. But that complexity is one of the biggest things. And that's part of what's the book is it's not written like a textbook. It's written like a math book. Like I had to talk to people for 25 years and they have to understand what I'm talking about. And yeah, if we don't, and the first step is education. If you don't understand it, how in the world are you ever going to manage it?
Or get your employees to buy into it.
Or do any sort of strategy, yeah, or even
Yeah.
know what to do. Yeah, so
Yeah.
so I think that overwhelms a lot. They're like, boy, oh boy. So we've traveled around the state and we were doing roughly 5 a year for a couple of years. And we did the first one in central Wisconsin, which is fairly rural. And we got over 100 people and we thought, wow, we're onto something here. So we started going around and we were putting on these events at a zero cost sum. We'd get a few sponsors to pay for the rooms and stuff, the room and so forth, and at a very low budget. So this year we're actually doing a big conference in Milwaukee, our first kind of annual conference, if you will. But this is really all about education. This is about, let's get the first step. Let's understand what's happening. And then we'll begin to talk about solutions.
From an employee standpoint, if I'm working for a company that does this self-funding, how does it, because again, you're not used to it. How people are nervous, how do you calm their nerves, or do you guys even get involved that far down?
It's a big part of what we do, Gary. So the employee education, right? So they come into these enrollment meetings, by the way, they're voiceless, they're powerless, and they're handed what's going to happen the next year. All the decisions have been decided for them. But one kind of, I think, when sometimes when we talk about our plan, which it's really more or less, we have the existing plan, which is still have all your same old options and the hospitals and deductibles and so forth. And then we bolt on this column that's totally different, that's completely no cost, actually higher quality. And so there is some education and it takes some 3-6 months. Sometimes the first year is the biggest learning curve. But once they get it, they start to get excited about it and they start to utilize it and they smile when you don't have those increases the next year. But I always like to point out the misunderstanding. Some would say, oh, that's just too much education. That's too much. We'll confuse them. And I jokingly say, really? So I used to go into meetings, these old school benefit meetings, and I'll say, show of hands, there might be 30 people in the room, there might be 50. How many actually understand healthcare and how your benefits work? And I would get two hands. And those are probably the people that are using it a lot because maybe they're sick or something like that. So let's not pretend that people understand even the basic plan designs of premiums and deductibles and co-insurance and max out of pockets. Let's not pretend that people understand that because they don't.
Right. Now, from the employee side, is it basically that they have I'm going to call it a credit card or something that anytime they go to the doctors or anything else, they're just using that to pay the doctor? Or is it that they have a prearranged process with whoever the doctors are in doing this?
Yeah, so we have a picture that I had made many years ago that kind of describes how this works. So I was joking when I said a credit card, but that's what companies do. And there actually are some options like that in terms of shopping. But like in our plan, it's really just another insurance card that looks the same. It's got maybe some different names on it. But the difference in our model, in the free market model and the shopping model between a traditional model is that the traditional, they put you on this one lane road. They call it a network, right?
Right.
But it's a one lane road without exits. And they say, go get your health care here. We have a supposed better deal. We get a 40% discount. And this other one was only a 35% discount. So my broker said to take the 40. And then we asked the question, right? What's the unit price? What are you paying for it? Oh, we can't share that. Or that's a gag clause, or we don't know that. Wait a minute, right? I'll give you 99% off my pickup truck then. And you'll say how much, and I'll say, I'm sorry, I can't tell you it's $1 million. We've got to just be smart shoppers. So that's a lot of the strategy, is to say, let's shop for value. Let's evaluate quality. On that one lane road, by the way, you don't even get to see price either until you get the bill, until it's too late. So you're being bounced around like a pinball in these traditional hospital systems, doing as the doctor tells you to do. You're not even really shopping. You're just following direction. And it's an absolute lose for the buyer. Imagine if Best Buy, which I use a lot because it's built into their name, Best Buy.
Right.
It implies shopping, doesn't it? It implies it's better than Sam's or Walmart or Costco or wherever you might buy your TV. It implies shopping. The Best Buy's here. We want you to choose us. Imagine if you had a one lane road and Best Buy was your only in network. Imagine what would happen over time if Best Buy knew you couldn't walk away. You couldn't go get another better deal. I think costs would go up because they'd say, gotcha. And whatever they tell you the discount might be, you still need to know what you're paying for the service or the product.
Now, does this self-funding only work for people who have a younger staff, younger employees that are healthy, or does it really make a difference?
And yeah, really, age is the biggest predictor of healthcare costs. But so you run a census, and Stop Loss does their thing, and they'll see what the risks are, if they will. On a fully insured plan, this I think will change over time with the new laws, the CAA law, but they don't tell you anything. You have age and you have address and you have no specific, usually healthcare information. But no, this plan, this strategy, if you will, and it works in small or large. It works in private or public, young or old. We actively manage the plan, and we help people with their healthcare. And so it's becoming so popular, by the way. I don't know if you knew this, Gary, but since the book's release in July of last year, this gives you an idea of how hungry the market is as they wake up. I had this best practice group that I started in Wisconsin, and it was 1,200 people, and I put it in print when the book came out. And today it's almost 3,400 people. This is just employers and others wanting to learn about it. And I'm also getting invited all over the country now, in something like 12 states in 10 months of this year, to go and just give a talk and say, here's how I did it. Here's how others are doing it. And it is possible, and you can do it too. And there actually is a solution to this runaway train of healthcare costs.
For looking in your crystal ball, how do you see what you guys are doing? How do you see that affecting the market? Do you think it's going to make it more of an open free market, or how do you think this is going to affect things?
That really was the goal, and is the goal, is to wake up a suppressed or restricted, monopolized market. So when we have a free market, those conditions often regulate themselves, and you have healthy competition for quality and accessibility and cost, and lots of good things happen. It becomes more fair for the consumer. We believe this is the future of healthcare. Now, there are a large variety of people scattered about the country that are doing maybe forms or pieces of this. I'm not sure anybody's really doing it as comprehensively as we are in the full plan and all the things that we do. There's about 35 plus pieces in that strategy, some of them big, some of them small. So it's an interesting thing. There's a need everywhere, and we have a solution that I think others really don't fully have. But we share a lot too, and we believe a rising tide raises all ships. The more that are in this game and the more that are helping employers, I support them.
Yeah. because I look at it in my mind, looking at it, this would be um, where the employers also could give incentives to employees and staying healthy and doing their annual physicals and keeping up with stuff instead of, because that's seems to be one of the complaints with our current system is that people aren't taking advantage of the annual physicals and the bumps and bruises and stuff like that. They're not taking care of them right away, and they end up festering into something more.
Yeah.
So I
Yeah.
could see how doing this and the employers incentivizing people to stay up with their healthcare and stuff like that would definitely help benefit not just the individual with staying healthy, but also the company, because that would be less money being spent.
You got that. Yeah, this model is interesting, and you can put a health, you can put a like a wellness program that gets them in. So we use what we call direct primary care. So direct is in taking out the expensive middleman insurance that's not adding any value, but a lot of cost. But there are a lot of doctors, like in Wisconsin, this movement that I'm helping to lead. In 2020, September, I believe it was, there was an article in Madison that said we have 16 direct primary care clinics. These are doctors that were frustrated or that left the hospitals and started their own primary care practice. And so they could do things the way they want. So they could have a 500-person panel instead of over 2,000. So they could spend 30 or 60 minutes. So they could actually get you in the same or next day, or at least within the week, instead of 3 or 6 months. So they could put you on a treatment plan. And so this direct model is really taking off. Today, I count over 123, by the way, 4 years later, less than 4 years later. That's how many doctors are. The doctors are also frustrated in a system where they're given 7 minutes in primary care, and all they really have time to do is refer, prescribe,
Right.
but not develop a relationship. And so this direct movement is really catching on. And it's, as you mentioned, it's good for managing health because so many people are avoiding their healthcare today because of the cost. And so you avoid it long enough, it becomes a big deal, right? You avoid diabetes symptoms long enough, and pretty soon you have diabetes 1 and you can't reverse it. And so all sorts of medical conditions that they can actually help the person with if they're accessible and they can go to them. And so they have, in our model, they have unlimited primary care and it's zero cost to the member.
I think, my opinion is it's not so much the cost, okay, I got to wait in a waiting room for an hour after my appointment because the doctor is so backed up because of all that. Like you're saying, if they have a smaller pool that they have to deal with, then they are able to do more. And I have seen where there's been more, and maybe it's the direct and versus concierge, the same thing. They limit the number of patients that they're going to take so they can make sure they service everybody, and they're charging a monthly fee.
Right.
And then if there's any additional services or whatever, they bill you for it. And then my understanding is you're able to get that back from the insurance company. In your model that you guys are doing, is somebody able to go to a concierge doctor where they're paying that monthly fee to them to be covered?
Yeah, that's generally, there are a rare few that still charge the fee for service that are independent. But yeah, so it's called a per member per month. A member is a belly button. So it's an
Right.
employee or their family. And in our plan, for instance, and many are doing it this way, but the plan pays 100% of that PM. So let's say that's $60, then the plan pays that. That gives the member 100% access to that clinic as much as they need. And then we go further and we say anything done at that clinic, at that primary care clinic, is also free. So if you have labs, we can get labs that would be over 100 in the hospitals. They're $3 or $4 of what the plan's actually paying. That's what they actually
Right.
cost. And so of course we can give that away. Of course we can say, get your labs, get your crutches, get your casting, whatever you may need, because $4 we can afford, 100 we can't. So
Yeah, that's my opinion. And again, I think that's more the way that we need to get healthcare to go. So people who use it are beneficial, and it's more cost is able to stay lower, and people are able to actually get in there and afford getting in there. Matt, we've covered a bunch of stuff. What have I not asked you you wish I had?
no, I think, yeah, so we, Self-Fund Health is a health plan, and we put this all together, all this complexity, and then we help manage it for the employers. They can also DIY it just like I did. So that's a choice, but it's a lot of them don't have the time or the resources to do that. But this direct primary care, as we call it, and then that leads to direct specialty care, these hundreds of independents that are scattered across the state and in the country, we believe is the future of healthcare. We don't believe there's a shortage of doctors. Many say there's a shortage of primary care doctors. Maybe there is. What would happen if we solve things, if we help the patient actually solve their issues? If you gave your mechanic 20 minutes and said, here's, you got to go through 30 cars today, how effective do you think that mechanic would be? And maybe they had to refer. You'd have a lot of broken cars driving around town. And you say, wait a minute, you saw 30 cars, right? You worked on 30 cars. And say, no, they're not getting fixed at all. They're being rushed through a money-making system. So when these docs, when they hit 500 or so, these primary care, these DPCs, they'll hire another one. And they'll hire another one. And that's what they're doing. And they're growing. So a lot of it comes down to effective care as well. So it's not just about dollars, but the two usually fit together, right? When you provide quality care, you actually spend less as well. So that's what we're doing, and we're growing pretty fast.
Great, great. So Matt, two things. One, where can people find your book? And two, if they like what they hear and they want to talk to you guys, how can they reach out to you?
So our website is Self-Fund Health. And so just the straight, no dots or anything. And then my email is matt@selffundhealth.com. And so you can check those out. Certainly feel free to reach. The book is on Amazon. A lot of times we see forward-thinking advisors, or we do offer even a free book to like employers or others who want to read about it. There are forward-thinking advisors that'll buy 20 at a time or 100 at a time or whatever it may be, and they'll hand them out to employers. The book is an education tool to say, here's how healthcare is really working or not working, but here's how you can make it work for you. And so that is one of our best resources that we have. I'm also working on a digital online course for those that maybe aren't readers. That's in the works. But the book is written in a way that's fun. I've had non-readers tell me they really liked it. I've had someone say, I never read a book, but I read yours. So
Right.
I've hopefully done something right there.
That's awesome. Matt, I really appreciate your time. Appreciate the talk today. There's a lot of good information.
Yeah, it was great to get to know you, Gary. I appreciate the time.
Definitely. Hey, this week, my guest was Matt Ohrt, and he is the co-founder of Self-Fund Health. Thank you, guys, and I'll see you next week.
49 faces looked to him in triumph. Over the last 12 months, they had each taken turns and promoted his business for a week at a time, driving over $987,342 in revenue. What if you had a network of 50 centers of influence who promoted your business every week for a year? Grab your copy of the #1 Amazon best-selling book, The Ultimate Guide to Growing Your Business with a Podcast, at 33% off the Amazon price by going to ultimatepodcastbook.com. Again, that website for 33% off the Amazon price is ultimatepodcastbook.com.